Hi, everyone. As Francis said, I'm a senior management consultant at Jevity, and I contribute to the program as a lecturer. In my day-to-day work, I support a range of clients with terminology-related work, including eHealth catalysts like eHealth Infoway, provincial programs, software vendors, and sometimes hospitals. And at our clients and in the market in general, what we see is a growing expectation that the digital health solutions that we're implementing are going to enable new care models that enable the quadruple aim goals of improving the patient experience of care, improving the health populations, reducing costs, improving care team well-being. And when you look at this altogether, it's a tall order. Like what it means in practice is that the digital health solutions that we're implementing not only need to be able to share information within and between the organizations that implement them, but they also need to be able to recognize the needs of the patients whose information is in there and help direct clinicians toward the right actions to care for those patients. So to deliver evidence-based medicine. And the role of terminology standards in there is to enable those solutions by helping ensure that providers capture information in the medical record in a software application in a way that's precise, and then to help the system translate that information into actions by recognizing what the clinicians have entered into the application and being able to act on it. And in order to make that work, organizations need people who understand the terminology, understand how the terminology standards work with one another, and with messaging standards like HL7, as well as with the applications themselves. So the reason why Jevity supports the program and I contribute my time is because we believe it plays a really important role in training people to fill roles that will become more and more important as we depend on digital health solutions to help organize and deliver healthcare services in Canada.